talk about, directionally what they're doing here, what the ONC is doing here, what CMS is doing here. So, you go from administration to administration. How much does the change in administration change the direction and focus of ONC, do you think?
Well, it's fascinating, isn't it, that I've served Bush, I've served Obama, and certainly stayed in touch with everybody who's on the current committee, the Federal Advisory Committee in the Trump administration. And there's a remarkable consistency. And that is, sure, politics change, but really the trajectory of IT doesn't so much. So a lot of the same people who were at ONC back in the Obama administration are still there, Steve Posnack, John White. So they are diligently moving us along a rather consistent program. And in fact, sort of the theme of the current administration is less regulation, less burden, all the rest. But the themes of what we're working on are fairly consistent. So I don't feel like there was a revolution here. It feels like an evolution.
Yeah. I mean, the only thing I see that's a little slightly different in this is, again, the bent being towards sort of free market. It's we believe that access to information is critical. Not that interoperability is always about access to information, but this whole thing of, hey, let's publish cost, I think is fascinating because that's sort of a free market mindset. If we start publishing cost, there will be transparency into how much something is going to cost somebody and how good the doctor is or how good the system is. And I think that's one of the first steps for them in seeing this not as a universal healthcare program, but as a more of a free market program. We'll have to see how this plays out. The levers, the levers that the government pulls do not happen overnight. They generally take many years to play out. So by the time this starts playing out, there's probably a new administration and change. And that's one of the harder things to really, for health system CIOs and health systems in general to sort of adapt to is the constant change in the regulatory environment. Costs money and costs resources and time. I mean, can you talk to that a little bit? How do you prepare for that? How do you adjust for that?
Sure. So governance is the key issue. So I have, since my earliest days as a CIO, had a guiding coalition of doctors and nurses and pharmacists and social workers and administrators who meet on a monthly basis to understand, well, what are the strategic imperatives, regulatory compliance imperatives, what is it we need to do if there's a sentinel event for safety and quality, how do we be impactful? So I had the hard discussion with them in 2009. I'm sorry, but for the next 5 years, all of our business imperatives are going to have to be put on hold because we have ICD-10, meaningful use, the HIPAA Omnibus Rule, and the Affordable Care Act, and you must do them, right? No choice, right? Because otherwise we're all going to go to prison. And so the governance group said, ICD-10 is not a very sexy project. Are you telling me we're going to codify flaming water skis, falling satellites, and chickens hitting you on the head? And I said, yeah, but must do. And so, but wait a minute, I have this pet project that is going to impact, 25 doctors. Well, sorry. And the governance folks gave me the air cover to focus on ICD-10 and those things that weren't that exciting, but were must-dos. But so then here we are in this era, as you described it. We're out of that regulatory must-do era and into the private sector has to take a lead. You might have certain outcomes, you might have value-based purchasing or whatever, but how you do it, it's up to you. And my governance committee has now said, well, fabulous. Let's catch up on all the unmet needs of the meaningful use era. And here are a couple of strategic things. And by the way, we'll make sure that what you do aligns with a future where we're paid with risk contracts. But we're going to do it our own way. And that's okay. And as you point out, if 5 years from now, we get back to regulatory directed process, the committee will help me through that.